Afternoon. We're just, as a few more people are coming online for the brief media event today, we will just give one more minute to allow those to come into the call and then get started. Okay, I understand everybody who's registered is now on. Welcome, ladies and gentlemen, to our brief signing ceremony today for the Barrie Health Accord. I'm just delighted to be joined today by the leadership of the 5 organizations in our community, in our city, and in our region who are responsible for delivering emergency services and health services in our community. And these 5 leading organizations are coming together today to sign an agreement to collaborate. This is very much the first day of a very long-term process, but one that I believe can make a very significant difference towards our community's health and well-being. The Barrie Health Accord is at its core an agreement for 5 of us in local government and healthcare to collaborate on addressing the health challenges that face our community. And the organizations you see in front of you are responsible for delivering emergency services and healthcare, but also all share, I believe, a strong belief that a healthier community comes from collaborating on addressing the determinants of health. And I'll say a little bit more about that later. But by way of introduction, of course, the 5 organizations are the City of Barrie, myself, Andrea Campobasso of the Mayor's Office, and CAO Michael Prowse are on today's call. Warden George Cornell and CAO Mark Aiken from the County of Simcoe. From the Royal Victoria Regional Health Centre, Janice Scott, Chief Executive Officer, and Charlotte Wallace, Chair of the Board. From the Simcoe-Muskoka District Public Health Unit, Dr. Charles Gardner, our Medical Officer of Health, and Anita Dubois, Chair of the Board. And from the Barrie Police Service, Chief Kimberly Greenwood, and the Chair of the Barrie Police Services Board, Angela Lockridge. Thank you all for being here today. So here's how today will go. I'm just going to read the text of the accord just before we sign it. We are all going to scrawl our signatures and then hold up our copies so that we can do a screenshot, because in the day of COVID, that is how we do what we might otherwise do at an in-person event. So we'll do that. Following that, I'm going to ask each of the 4 other organizations, the signing individuals, to just make very brief remarks, and I will conclude with a few remarks on the health accord and where we go next. So just before I read the text, big changes often start with a single step, and the landmark single step, I believe, today is the bringing together of these 5 public sector organizations. Collectively, you are looking at the leadership of organizations that have annual budgets in excess of $1.2 billion and who share strategically an interest and at our core, we all serve the public. And we know the public is best served if we are able to take a long-term view. And though the challenges of COVID right now mean we are all pressed to address the urgency of a global pandemic, both COVID and the pre-existing situation in our community really demand that we look at how we can work together over the longer term to create a healthier community and address health and social challenges. And that's what this is about. And though I'm sure we will all remain laser focused on the COVID crisis that's in front of us, today is very much that critical first step towards a longer term, healthier community and collaboration that I believe will benefit our residents for the longer term. So with that, I will read the text of what we're going to sign. The Barrie Health Accord has a few statements by way of introduction, and it reads, whereas we believe community health is about achieving well-being in all aspects of life. And whereas we believe that fighting root causes with upstream investment is the path to long-term sustainability. And whereas we believe that improving the health of our community takes decades, Therefore, we need to think generations ahead in order to achieve community health, safety, and well-being. And whereas we believe a collaborative and coordinated plan for investment in the health and safety of our city and our region will result in the efficient deployment of resources. Therefore, be it resolved as follows. 1, we commit to working together over the next decade in a collaborative, coordinated effort to build a healthier and safer community by making sustainable investments in the determinants of health. 2, we commit to participating in a community-wide planning process to coordinate these investments. 3, once developed jointly, we commit to pursuing these project priorities across our organizations. And 4, we commit to setting measurable outcome metrics and transparently reporting them to our community. It is dated this day. And so with that, I will ask everybody to scrawl their signatures on the relevant part of the document. And just hold that up so that we can there we are. Lauren, were we able to capture that?
Yes, I believe so. Thank you.
Okay, thank you very much. Thank you all so much for your support for this initiative. All of these, I should have said at the outset that each of the boards and councils of our 5 organizations have endorsed a motion in support of the Health Accord, and that, of course, is what's authorizing each of us to sign a similar document today. And I just wanted to give a moment for each of these organizations to say a few words. So with that, I'll pass the floor over to the Warden of the County of Simcoe, George Cornell. Oh, we'll just get you off mute there, George.
You'd think by now we'd have that down to a science day, but I didn't want to interrupt you, Jeff. So thanks very much, Jeff, and good afternoon. Bon après-midi, Ani. On behalf of the County of Simcoe and our County Council, it certainly is an honor for me to be here and take part in today's signing of the Barrie Health Accord. And I do want to recognize all the other partners that are joining us today. Congratulations to us all. Over the past 7 months, COVID-19 has put a huge strain on the regional social, community, health and emergency services and programs. But we know that these demands and pressures have existed well before this global pandemic. This landmark health accord is a commitment among regional partners to address and approach issues and challenges impacting the health and well-being of our communities and residents, but by doing it differently. This is truly a proactive approach to address the root causes impacting many of our healthcare services. Through creative and innovative strategies and solutions, the goal over the long term is to alleviate some of the pressures on our systems and to improve the quality of life for our residents. We look forward to working in collaboration with the City of Barrie, Royal Victoria Regional Health Centre, Simcoe-Muskoka District Health Unit, and the Barrie Police Service to proactively address these challenges and to building healthier, safer, and more sustainable communities. Thank you. Merci. Miigwech.
Thank you so much, Warden Cornell. I'll call on Janice Scott on behalf of the Royal Victoria Regional Health Centre.
Thanks very much, Mayor Lehman, and good afternoon. I'm pleased to bring remarks on behalf of Charlotte Wallace, the board chair, as well as myself. When we think about healthcare, people often equate that to hospitals. But in fact, RVH's primary role is to care for you when you're seriously ill or injured. And all of us need to be thinking about health and wellness well outside the hospital walls. In the next 2 decades, Barrie's population is going to double. And of course, it's also aging. And this combination will put a huge strain on our system. We don't just look at growth, of course, we also look at the health of our community. 45% of our residents have one chronic disease, and 20%, or 1 in 5, have multiple chronic diseases. So these are huge risk factors. And we do know that if we focus, we can prevent some of these chronic diseases. And in fact, we can also delay them. So for example, if we really focus on nutrition, exercise, moderate drinking, and not smoking, this can have a huge impact on the level of chronic disease in our community. We also know that many of the variables exist again outside the hospital system to really influence these risk factors. For example, education, that includes exercise from kindergarten through to grade 12, adequate housing, and of course, adequate employment. So in the next while, RVH will be doubling the size of its facility and also looking at a site in South Simcoe. With these partners and so many others, it's just vital that we work together so that we can really shape the community around health and wellness. I believe that together we'll find solutions to reduce chronic disease, and we'll also ensure that our expansion will actually meet the acute care needs of our community. So together we need to keep people healthy and out of hospital. As we all know from our January 1st commitments, maybe it's just me, but we often try to make lifestyle changes, and they're really tough. And of course, they're even tougher to sustain. So I like to think of today's accord as the day you plant the seed is not the day you eat the fruit. So today we're going to seed. It will take root. I am convinced it'll grow and flourish. And together, the fruit of our labor will be a healthier community. So Mayor Lehman, thank you so much for your visionary leadership in bringing us together. I'm very familiar with all the partners here and many others. I look forward to continuing to work with you for a healthier community. Thank you.
Thank you so much, Janice. On behalf of the Simcoe-Muskoka District Health Unit, Dr. Gardner. Oh, mute.
Okay, there we go. I swear I had it ready, but it muted itself. Anyway, thank you very much for the honor of being part of this event. I'm certainly honored to be able to represent not the health unit as well as the board of health. We've been working with the city for many, many years, for decades, to address the determinants of health in partnership with the city's visionary approaches to things we've always benefited from, being part of your age-friendly strategy, your youth-friendly strategy, climate change, the Healthy Barrie Initiative, and now we have the Health Accord for the city of Barrie, and also with the county as well. It's very good that we've extended the geography and been inclusive of most of our territory. Here we are in the pandemic of the century, and I can think of ways in which municipalities have been critical to the response, declaring an emergency, using your own bylaws to help strengthen the ability for people to physically distance. We know in this pandemic that people in certain housing situations have been much more heavily hit. Those that live together in crowded housing have been more heavily hit, those in racialized neighborhoods. And so the determinants of health become evident in the pandemic, and they're also evident in the many other issues that have predated the pandemic and the many issues that we'll face going forward into the future. I think it's marvelous that we have a 10-year strategy in mind, or horizon in mind, with this approach. It's certainly entirely accurate that health is built over time. We might respond to a crisis at the moment, but going forward, if we're going to make serious differences and improvements in the health of the population, it'll have to be done in a very broad way together as partners. So certainly the Board of Health is very pleased to be part of this initiative. And thank you once again for your leadership in bringing us together.
Thank you very much, Dr. Gardner. And last but certainly not least, on behalf of the Barrie Police Service, Chief Kimberly Greenwood.
On behalf of the Barrie Police Services Board and the service, I'm honored to be part of the signing of the Barrie Health Accord today. We're very much looking forward to continuing to work collaboratively with our 5 partners to implement this vision for the future of our community's health and wellness. Our members regularly work with individuals in crisis in our community to ensure that they have access to health and wellness resources. Since early 2019, our community outreach and support teams, or what's commonly called COAST, has paired a non-uniform officer with a crisis worker from the Canadian Mental Health Association. Together, they respond to 911 calls where there is a concern for mental health, They conduct follow-up visits and work with those in crisis to ensure that they are able to access the resources and assistance that they need. This is just one example of how strong partnerships within the city of Barrie can assist individuals and families who may need support from more than one single service provider. We see firsthand the importance of ensuring we provide the proper support to those in need, whether it is a person that is experiencing a mental health crisis, an intimate partner or violence survivor, or an individual facing the challenges of addictions and homelessness. This is why it's so encouraging to be involved in this partnership. The right supports at the right time can make all the difference in an individual's life path. It is something all of our 5 organizations have been working towards individually, but this collective partnership focusing on addressing the root causes and long-term planning will strengthen our efforts to improve the health and wellness of our community as we grow over the coming years. Like all of you, the Barrie Police Service is committed to the safety, health, and well-being of our community. And we know that the Barrie Health Accord we have signed today is an important and positive initiative. I thank everybody.
Thank you very much, Chief Greenwood, and thank you all for those remarks. Just by way of conclusion of today's event, I wanted to say a few things, and picking up very much on what Chief Greenwood just talked about. You know, these organizations are already involved in excellent collaborations. I think of everything from the Connected Core program that RVH, the Barrie Police, and the city undertook to assist in the opioid crisis and to expand outreach services. I think of the many partnerships between the county, the city, and in many cases as well, public health on everything from healthier planning to housing issues. But the collective resources of the 5 of us, I think, is an unparalleled step. And I also wanted to say today that there aren't many communities, I don't believe, in the country where this would be possible, and a great deal of the credit for that goes to the strategic leadership of these organizations. Each of you are very much focused on the long term for the community, and we're very lucky in Barrie, I think, to be served both by councils and boards and leaders in the individual organizations who have that longer term perspective. It is so difficult, especially at a time like this during a state of emergency, for us to continue to remember that we're part of a much longer term challenge, and that is to address those determinants of health. You know, our paramedics in their community paramedicine service, our fire prevention branch here at the city of Barrie, the crime prevention work and the collaborative work that is led by the Barrie Police Service, all speak to how emergency services undertake prevention. But bringing those prevention efforts together behind the social determinants of health, which lead to so many of the calls to our emergency services, and then, of course, in turn, to the emergency room at RVH. RVH already addresses the determinants of health through their work, but for all of us now to get together and say, how can we make a meaningful impact through collaboration in addressing those chronic health conditions which lead to the higher demand for service, but ultimately result in a healthier community. And I want to highlight that the Public Health Unit has led this charge for decades. This is certainly not something that we just discovered, the determinants of health. The Health Unit has been telling us for years that this is how we build a healthier community. But I believe today that through the agreement to collaborate and through the ongoing work that can result from this accord, we have a very powerful new tool as a community to shape a healthier future. So I want to thank, again, all 5 organizations, the boards and councils of those organizations for their support and for the work that we will do, notwithstanding we have other pressing priorities with COVID today. They have that crisis itself has highlighted in many ways why today is so important. So thank you all for your work and for being part of this. And with that, I will turn it over to Lauren. I know there are some media on the call who have a few questions of us today.
Thank you, Mayor Lehman. For our media attending today, please use the raise your hand feature. Please direct your question to one of our panelists, and you may ask a question and a follow-up question. If time permits and you have additional questions, please again use the raise your hand feature, and we will do our best to accommodate them. For anyone calling in, please do press #9 or *9 rather to raise your hand and *6 to unmute. Any additional questions post this event, please do reach out. And we have, and go ahead, Siobhan.
Sorry, I was just, again, figuring out mute. This question's for anybody, really. It could be for Mayor Lehman or Dr. Gardner. What is tangibly different about this accord? Because these groups have all been working together, especially this year during the pandemic. So what's really different about this signing of this accord?
Sure. Well, maybe I'll start, and then Dr. Gardner may want to offer his thoughts as well. Two things that I would point to right away. First, this is a long-term commitment. I think we are all working very well together to address the pressures of the pandemic. That is a crisis that we all hope will pass sooner than later, but is certainly an event that we're in the midst of, and we as a global community will eventually resolve. It has highlighted, just as the homelessness crisis, the opioid crisis have highlighted the pressure that it results on all of our services from the determinants of health and the underlying root causes of why those crises, as well as the COVID situation, are disproportionately affecting certain populations, and why they're creating frankly, an unsustainable level of demand on all of our services. So what's different? It's a long-term commitment. The second thing I would point to is that we are specifying the determinants of health. While each of us work in different ways, I think of the county's work on housing, I think of the public health unit's work on many of the determinants of health, but particularly things like food security. There hasn't been, I believe, a comprehensive effort by local government and healthcare together to say, how do we collaborate to target those things that we know have the biggest impact on the long-term health of the community? And those root causes are things like food, nutrition, active living, housing, and the other determinants of health. So, fire prevention efforts target preventing fire, but they can also target preventing health calls, opioid calls, by targeting the reasons why people end up in crisis and needing emergency services. So I think that is quite different, and by collaborating over a long-term timeline can allow us to make a great difference over time. Dr. Gardner? Oh, mute still.
Do it again. Hello, you can hear me now, right?
Yeah.
It is, I swear it's auto muting on me. Anyway, to me, we in public health need to take every opportunity where a municipality or municipalities want to come together and improve health, because municipalities hold the key, the levers to the determinants of health like no other agency that I can think of. They're close to the people, and they have a very broad mandate, and they have legitimacy and the ability to pass bylaws. It's crucial that we take those opportunities. And so when Mayor Lehman had come forward with this opportunity, I felt it was very important that we position that to our Board of Health. We did note that we're challenged with timing because of the pandemic, but this is a long-term initiative. And there's no moment like the present, really, in order to get on with long-term initiatives that will bear fruit over time. And I would say that it's terrific that we have Simcoe County as part of this as well. The geographic scope is very broad. So to me, we take opportunities as they come. And when a municipal leader wishes to enter into a long-term broad agreement with multiple agencies that can each influence health, we're in. We have to be in.
You have a follow-up, Siobhan?
Yeah, and then I guess, is there a way by which you measure the success of this, of the accord? especially as Janice mentioned that, you're going to see an increase in demand because you're going to have a growing population and an aging population as well.
Again, I'll start and then feel free to jump in, anyone. Yes, and we know that there are going to be pressures on acute care that will need increased capacity at our health center. We know there's going to be pressure on emergency service, and there will need to be capacity in our emergency services. And of course, the value and importance of the work of public health is being demonstrated every minute of every day during this crisis, and indeed before. But I think the way that we measure this, we will determine from here out. I can give you some early thoughts that each of us who run an emergency service, that's 3 of us out of the 5, will be looking at our calls for service, and those calls that have at their root cause a determinant of health that could be better addressed to prevent that call for service. None of us want to be responding to people in crisis. And so we have prevention branches in all 3 services in one form or another that seek to reduce the demand for those crisis calls. So that's one way that we may measure it. And similarly at the RVH, the number of people who are requiring ER admissions for preventable reasons. But I think, as Dr. Gardner has often told us, the long-term health of the community, and our community in particular, we have some chronic diseases, and Janice mentioned some of the statistics. Those conditions are things that we can collectively change over time. So, we have recently talked about the Healthy Barrie initiative, partnered with the University of Toronto, that is reporting on the incidence of chronic disease in our community. And in my hope, over time, we will start to see those rates start to be affected by some of the work that we can do through the Health Accord.
Maybe I could just add, Mayor Lehman, that with the Barrie Health Accord today and a laser-like focus of these partners and so many more, 10 years from now, when we're reporting on chronic diseases in the Barrie area, we should be less than 45% of our population have a chronic disease, and far less than 20% have more than one chronic disease. It'll be an absolute measurement with this laser focus and this commitment to a decade or more to improve the health of our community.
One more thing I might add, Mayor Lehman, and that would be that we would also look at perhaps neighborhoods. We would look at groups that don't do as well over time. There are many ways to measure health. Certainly as a health unit, we would bring to bear our resources with regards to how you can approach measuring health and measuring outcomes over time. But we already do have an excellent tool for looking at individual neighborhoods. And that would be something as well I think that'd be important to look at, is how equitable is the distribution of health? Are we leaving anybody behind? Everybody being brought along, or those that are most impacted by some health issues able to make real improvements over time? It's good that we're choosing a long time horizon, because it's totally accurate that it takes time to make those kinds of differences.
Thank you. Next, we have Chris Simon. I just ask if you can unmute yourself, Chris.
All right. Can you hear me?
Yeah. Hi, Chris.
Beautiful. Hi. Just wondering if there are any specific examples that anyone could point to in terms of how this accord might be applied to 2 of the bigger health crises that we're facing right now, the opioid epidemic and the COVID pandemic.
Sure. Well, I'll start with a thought on opioids, and others may want to jump in on either issue. There are some very innovative approaches where emergency services are trying to prevent people who are stuck in many ways in the cycle of addictions. So, early on, I would say that Connected Core, which was a Shift Government project, is a very good example of the type of collaboration under the Health Accord that we can grow. And of course, that was an effort between the police, RVH, and the city to help get more people to treatment options in Barrie. And we saw patient numbers at RVH's RAM clinic increase substantially. Not all of that was due to Connected Core, but it was certainly a good example of the collaboration that can lead to that. I think all emergency services, Vancouver Fire Department, for example, is doing great work on fall